Good afternoon. Okay, welcome everybody. I'd like to acknowledge that the Northern Rockies Administration Center is located in the heart of the traditional territories of the Dene, the Cree, the Dunezaw peoples of the Prophet River and Fort Nelson First Nations. We further recognize the rights provided by our treaty. And finally, we celebrate the contributions and enduring presence of the Métis people in our region. So today we're here to talk about the Regional Hospital District. Please be advised that today's meeting is being recorded and streamed live for the public to participate. And that takes us down to any additions to the agenda for the hospital meeting. Staff, council, seeing none. Okay, adoption of the agenda, please. Moved by Councillor Gerwing, second by Councillor Dickey. All in favor? Opposed? That's carried. There is one set of minutes there from the inaugural meeting, January 9th. So we're looking for adoption of those, please. Moved by Councillor Dickey, second by Councillor Roper. Are there any errors or omissions? Seeing none, all in favor? Opposed? That's carried. Is there anybody online that is itching to comment on today's agenda? No? Okay. Is there any business arising from those meetings? Seeing none, that takes us down to 7.1 Regional Hospital District Report 0223, the overview of Northern Health Capital Plan. Staff, please.
Thank you, Chair and Board. This report is presented to sort of try to bridge a gap of information from the preliminary budget presentation late last year and what will be the final budget presentation for the hospital district in March. We've included a little bit more detail with regards to the longer term capital projects that are being that are in Northern Health's capital plan. And also wanted to make note of the notable item that was missing, which is the CT scanner. So just to summarize some of the information that we've gathered so far to date and wanted to present it so that we could give you an idea of what the finances will look like for the hospital district, given Northern Health's current capital plan and our abilities to requisition funds for those activities. So with that, if you have any questions,
Okay, well, I'm not even sure where to start. I know that this is just given to you, and this is not something that you're generating the information from. I get it. You're just pulling it all together for it. But I guess what jumped out at me, I get that there's some surplus here. But what jumps out at me is the requisition request, and I know that that's our maximum amount that we're allowed to request, and that's not really even what this discussion is supposed to be about. But that's what jumps out at me. We've got a potential $30 million hospital replacement, minimum 25 million. It'll take us 60 years to get our share of that. Like, that doesn't make any sense. So essentially, they're allowing us to fund the minor capital year over year. So anything less than 100,000, and then put some contributions towards their major capital, as they're calling. Is that correct? And in most cases, if we didn't have a reserve, we would be probably underfunded each year if we had to fund what they were looking for us to fund each year with the amount we're allowed to fund. Correct?
That's right.
So far, so good?
Yep.
And we really don't understand what's coming at us further down. And I think what we're looking for is there any cash available to free up the CT scanner? Right. And so I see that there's potentially $1.2 million, but if we spend that, there's not much left for the future. And it looks to me like at a cap of 200,000, we're barely keeping up with the capital right? That they're kind of sending at us now, and the hospital is older than most that they're replacing in the province, and so that probably won't stop anytime soon. That you have at least this minor capital replacement repairs continuing to come at us.
Yeah.
I mean, nobody has a crystal ball, so we don't know what's going to happen after 27, 28, 29. But it's clear to me, and somebody correct me if I'm wrong, that we're really not even keeping up, or potentially not keeping up with the capital requirements year over year.
So yeah, everything you've said is accurate. There's two pieces of information that I can share. One, with regards to that maximum requisition, when we recognized what that maximum was, we did reach out to our counterparts at the province just to see if we were interpreting that correctly, if any changes had come through that we perhaps weren't aware of, that aren't identified in the legislation, and no changes have been made to that amount. So we did double check that. And then the other thing is, of course, the ability to borrow for funding. But when you're capped at 200,000, if you borrow, you may not be able to requisition funds to pay that back, right?
Right. So did we ask, while we were asking, confirming that number was a max, did we ask what the process is for changing it, or how it's set? Or does somebody know that already? Well, I guess if we didn't realize it was there, that nobody would be asking the question. Okay, I get it. So I wonder if that's the next thing is, whether we're on the list for hospital or not, according to the criteria, we're at that spot where other communities are asking for new replacements. And if it's $30 million and say it's 10 years before we get it, it's probably $40 million. There's no way we can set aside 40% of that in order to be able to afford it. So there must be a way a process, I guess, to look at what your maximum eligibility is, and then how to go through that. And then whether or not you can actually afford it in your community, that's a completely different story. But understanding the process of how to change that, I think is important to moving forward, because that we don't have enough community raised funds to pay for the CT scanner. There are some funds here that would allow that, but then it might put us in that spot where we're just not able to keep up year over year over year, moving through the future. But we're not anyway. So yeah. I'm interested in your comments.
Yeah, I think I'm having a 1.2 or $1.4 million is great, but if we're looking at 30 or $40 million, or in 10 or 20 years, when we need a new hospital, like $1 million, $40 million,
yeah,
it's all, might as well, I don't know where my thinking is going right now, is might as well use the money to help people today, and then let's come up with a plan for what that hospital is going to look like in 20 and 30 years, because to my way of thinking is $1 million is a far cry from 30 or $40 million that we will need in 20, 25 years. I don't know. Maybe I missed something, but I didn't really understand that the tax requisition was capped at the $200,000. So we don't set that rate then when that's as much as we can ever tax for?
Not necessarily. There's the formula that is based on assessment values within the hospital district, within our region, and it's set by legislation. And so if based on the assessment values, the amount that we would requisition is closer to 100,000. But you have that choice. It's a maximum of 200,000 or the formula based on the assessment. And so we have a lot of growth before we even reach that 200,000.
So I guess that just even reconfirms for me now, let's put the money just my personal opinion is put the money to use to help as many people as we can today and start figuring out a way to get that changed, because that's got to be affecting more communities than just us. And it makes absolutely no sense if we have to raise money to replace a hospital building, but that we technically don't own, right? Because doesn't the hospital belong to Northern Health? So the whole, I don't think anybody has any answers right now, but it just does not make any sense at all to me that we are prevented from raising money through taxation, which is really our only way to raise money, and we're prevented from that. We're going to need a replacement on a building that we don't even own. So where does that take your head? I know where it takes mine. So that's my thoughts.
Takes my mind to futility. It's futile, but even if you were allowed to raise, it would take $1 million a year to put 12 million away in the next 12 years, right? Which they wouldn't let us do anyways if it's based on your. I'm just liking it, the Peace River Regional District Hospital District, where they've put away $40 million for the Dawson Creek Hospital. But I guess their assessment base is just that much bigger, right? It's because although we're a regional municipality, the assessment base is considerably smaller than what it is in the Peace River Regional District. Because I didn't realize they had a cap, but maybe it's because they're able to tax so much at the regional hospital district in Dawson that it's never become an issue. But now I can see where 200,000 is max. We're not going to be able to fund ourselves, with whatever's coming at us, and to spend it. I'm with you, but to spend it, they might not even let us spend it, because they'll say, "Well, we've got too many projects coming at you. You can't take that money away." Or is that their right? Right? Because if all they have to do is have $250,000 in capital next year, and we're $50,000 in the hole, so you have to take 50,000 from that reserve, and $250,000 doesn't go very far. Councilor,
I don't want to go off the topic, but the BC government recently announced $1 billion Growing Communities Fund. Do we have any information on that and what that can be applied towards?
We don't have any more details other than the article talked about the 1 billion, but no details as to what we might receive here in the community.
Well, that's just food for thought that, instead of going to Northern Health for funds that they obviously don't have, maybe we should be going directly to the province and lobbying in a different kind of way, because there's just no way we're going to keep up with these capital needs, even if it was $1 million a year, like you said, and that $1 million a year is unattainable. Well,
it is, but we just have to cut something else, right? We're putting away those kind of reserves for ourselves. So, but it's a significant chunk of change to ask the taxpayer to put up for. Councillor Dickey?
I was wondering about the rating, that 0.82, and the FCI Dawson Creek was 0.78. So how long does it take to get to that rating before we need to make a decision? Because when you read about the Terrace Hospital, it's actually a $600 million project. So I wonder if meeting with somebody like Terrace, their board, and asking them how they got to where they're at, or doing some research around it, because kind of interesting to see that it's a $600 million project and we have $1.4 million. That wasn't marked for anything.
Yeah, we've never been putting away money for a hospital. Yeah. Yeah.
So I was just going to mention that the facility condition index, it's not that when you reach a certain number, bang, it's a replacement. There's lots of deciding factors that go into that. And I assume a part of that is also community desire. And it's not just age of the building that you know, we can't easily say, well, we're this today and a year from now, we're gonna be this. So it's a complicated formula based on renovations, core systems, age, that pumps out this number at the end of the day. So I mean, we could stay at that level for another 5 years, 10 years. It's hard to say, but I think what's probably reasonable is that if you do nothing, then yes, your number is going to continue to go up. But they have been doing things. The boiler was replaced. They had to, I think there was a roof replacement in the last 5. So it's not a do nothing situation. There have been ongoing investments. So I don't know that we'll easily see that number continue to slip if you know, these small incremental improvements continue to be made. It's just, I think what we wanted to highlight was where we sit on the index. And that's a very real potential that conversation could surface in the coming years about potential major investments to that facility.
And whether it's regional hospital or whether it's regional municipality taxes, it's all coming out of the same pocket, right? So you have to put your resources where you feel the most fit is going to be, and you know, a hospital, you got to take some time to be prepared to pay your share. But the 200,000 is clearly a limiting. It limits us. I mean, you know, even if we hold all the reserves, the other reserves that we're putting into and cared enough out to get $1 million a year to put into a reserve for a hospital. It's yeah, for a building that we don't, but that's the same everywhere. That's the system, right? Yeah, that's the system. But if we're going to have a hospital here, and you know, we're already lower than places where they are replacing hospitals already. I guess the only reason I'm talking about is because it's got to be a consideration with respect to whatever we do. With whatever we do, I agree that $1.2 million is not getting us there. It's only 10% of the way there. We need to go, and we need a CT scanner sooner rather than later. I don't know what else to say about this report, except that you've brought us up to speed, and we kind of understand. So it's frustrating to know that you can't tax enough to replace 60 years. That's if we put everything towards the hospital replacement and didn't do a bit of capital the rest of the time. We're jammed, right? And we're not keeping up with the capital now. So I don't know how the province can expect you to do that. So we need to meet with the ministry. You know, we don't need to talk to them about what's happening with the potential for a hospital, what's happening with the maximum amount that we're allowed to requisition, what's happening. We've got to sort all of that out.
So these are good questions too for Northern Health. I think the board when they did the presentation was prepared to provide a bit of that day when they did the introduction of that meeting in December, I think it was, or maybe early January. They were starting, I think, to walk on the path of doing a bit of a presentation in terms of capital planning, and I think we caught a little bit of a time off there.
Because they weren't talking about the CT scanner.
So the intent, as Jason, the intent today was just a bit of an overview, because there's been lots of discussion with council regarding the potential, lots of opportunities around purchasing the CT scanner locally, and what wasn't part of the discussion is what are their impacts, what are the things on the docket in terms of what's up and coming, because we look at it and say, ooh, there's the reserve fund's kind of light, and there's detail outside of the hospital placement that takes away from that reserve fund. So we wanted to be able to put that forward so council at least was aware that there's not just this pocket of cash sitting there essentially that's not already essentially spoken for in other projects for years to come, especially when you consider what we could tax, so the regional hospital district could tax or requisition annually. Northern Health does have a presentation and is willing and wants to basically
walk through what the capital planning process looks like. And those are some good questions probably at that process too, to ask some of those questions, that they would get into the detail in terms of the projects that are up and coming. And talk about the FCI with the facility, that number, that index, and then it's a good opportunity to chat about what are those other mechanisms, if there are any, in terms of funding mechanisms. So is there an injection of cash potentially from the Ministry of Health or their hospital and whatnot? Is it, you know, if it's a $10 million hospital, it's a round number, is $4 million of that coming from the municipality? This is 40%, you know, and I think those are some good questions that are good to ask that group in terms of due process and how it works. And they're willing to have that discussion with council and present that. Virtually, obviously, is easier to. They did acknowledge that they would come in person too, but of course, there's logistical challenges with it now. But and virtually would be a little easier to try to schedule. But that's something that we can have lined up relatively quickly too for council.
Yeah, go ahead.
Just to add that, like, the community doesn't necessarily get a say in any of the capital projects, right? So I think that that's a huge disconnect, what we have been faced with. And we're just given a bill and, like, you know, the Fort Nelson Hospital lab chemistry and now analyzer replacement for 2025. Well, how much is that? Maybe we would rather have a CT scanner. We don't get to make that choice, right? We're just, so I think that that is a huge disconnect for us. The hospital is serving us as residents. We would like to have some services that are not there. And how do we get them there?
I'd like to know on the overall health planning. I think we talked about this a little bit at the last meeting of having an overall. Is there a report that's out on the strategy, like a 5-year strategy or a 10-year strategy? And how are we addressing the needs in 10 years as decision makers? Like, I also think that the funding shortages and budgets could also be enhanced if we had that really strong relationship with the nations and start getting federal money, partnering. I mean, the nations can tap into federal funds if they push on it. So I think that relationship building with the Fort Nelson First Nation, Prophet River, and Fort Liard really needs to address issues like this of how we can work together towards a better health system in the area. And it's concerning when you think about, when just quick read on the Terrace Hospital of it being 600 million. So even if that number is not something we're going to achieve in 5 years, in 10 years, if it's there, how are we going to hit that 600 million? So I think the long-term strategic plan and tapping into some funding that might, you know, be able to do a feasibility or a health strategic plan document for council and community to start considering would be beneficial.
600 million, that's got to be a regional hospital. Because the one in Dawson Creek is 100 million, I think, 110 million to completely replace the one in Dawson Creek. We'd never see that. This report says potentially it's 30 million, which might be a little on the light side in today's world, but it's in that ballpark. You know, yeah, with respect to a 10-year plan, or how do you get to the hospital? That's something that needs to be put together. If you know, if we feel to do that, and the nations definitely have to be brought in on that to see if there's even funding out there that they could use for this. Because there's nothing going from the nations around the piece to that Dawson Creek Hospital. So you'd think if there was the ability to do that, Northern Health would be all over that, getting them to try to come in on that hospital.
That's different. I think Northern Health's relationship with the nations are different than local governments' relationships with the nations. So I like what Councillor Dickey is saying, you know, that as a local government, we can continue to build our relationships and actually coming together for a plan as to where do we want to go and then how do we get there, right? And not necessarily keeping Northern Health out of it, but as a community or as a set of communities.
Yeah.
How do we want it to look like in the future?
Yeah. But I guess my only point was, is that they're doing it now there, and there's no First Nation involvement at all. And if there was the ability to do it, you'd think they would have been climbing all, because the relationship between the communities and the nations are good. So, yeah. Yeah. Yeah, so, I mean, I would like to be now, I mean, seeing this report, seeing what we can, I guess much as I hate to say it, I think I'd like to see the presentation on capital from Northern Health before I commit to using the entire reserve for a needy project. There's no doubt it's needed. But to put ourselves to zero when we're not quite making year over year, you know, where does that money come from? What are we allowed to do? Can we take it out of general revenue and put it in there? I mean, there may be, like, what are the options for
Yeah.
us?
And I think we can.
Because we're not funding, you know, we're not actually funded the way it is right now.
And I believe, and that's again, some clarification, because this, I mean, not necessarily new to the process, but we are kind of a little new as an organization because we're doing things a little bit differently and not necessarily aligned like we should have been. So
Yeah.
we're trying to understand ourselves. I think it's our understanding that there's an ability to take funds and make like you can pay for things, right? Like if the notary can buy a CT scanner, the NRM could buy a CT scanner, but it doesn't mean that the funds, I think, would come out of, or would need to come out of that reserve fund. You'd have to take them out of other funds.
I
do
see.
so, right? I think
Yeah.
that's it. And that's essentially be like a transfer of funds. I think the conditions would still apply. I mean, Northern Health would say, yeah, we'll take your $2 million or $5 million, whatever that value is, because the number I think currently is hovering around that $2 to $5 million mark for a CT scanner.
That's a remaining gap, obviously, for council to be able to make an informed decision, as we still don't know what the cost of
value is.
this machine is and the accommodations required to put it in the hospital. So Angela had provided an update last week that there's all hands on deck to get the business case completed. They're refreshing some data and they're looking at having it done in the next 2 weeks. Biomedical has come up. They did a site visit at the beginning of February. They've identified 3 potential space options within the hospital, but it's all dependent on the machine that's selected. And so if council recalls, Northern Health was working on pulling together an internal team to evaluate the machines, including radiologists, the physicians, their DI folks. And she hasn't been able to provide a timeline when that work could be completed, but I think in our meeting together, it was a 2-month project or something.
Mhm.
Yeah, so.
End of March, I think they said, didn't they?
Yeah.
Yeah.
January 16th.
Yeah.
So I mean, that's, the intent of the report today was to give you as much information as we had, which was, we know what we have available on our side, but we also trying to understand that without the context of what the project cost is going to be, which is challenging right now, but.
I just think I want to add, for those that weren't around the table the last number of years when that surplus was accumulated, it was our understanding that it could be used for, our recruitment process. Like, we weren't restricted. I think that is a really important point to remember. So if that has to come out of something else that the NRM, I think, it's only fair. Like, I would not want to see us restrict that because we're worried about looking forward when this amount was accumulated with a certain understanding that it could be used for X, Y, and Z. And now the new understanding is it can only be used for A. So from my head, it's like, okay, so then if these are the rules today, then let's start. We'll start a fund for A, and X, Y, and Z, we need to have that money available for what it was intended. Does that make sense?
Yeah, except that it was intended for operational purposes that you're not allowed to collect money for. And if you follow your argument all the way through, that money should go back to the taxpayer because we collected it inappropriately.
Well, I think if we check the meeting minutes though, on every single budget, the question was asked, can that be money be used for anything intended, like anything medical or health related, I think. And the answer was yes. So that's how it was collected. It wasn't intended to be used to fund a fire truck or something like that. Like there was a certain guideline as to why that was being accumulated. It was health related. So I don't necessarily agree with your argument that if to follow that through, then it would have to go back to the taxpayer because it will be used hopefully for something health related.
But the question was asked in-house. It was not asked out. So it was a mistaken understanding within the entire organization. So you look, even though it's a mistake and there's no blame, right? When you point the finger, there's 3-point range, take it back at yourself. There's no blame to be attached. The fact of the matter is it doesn't meet the legal expectations. And so unless you use it, in my view, is that legal expectation is that the regional hospital district taxes for capital purposes, not operational purposes. So if you made that mistake and just said, we're taxing it for medical purposes, not the same, there's more nuance there. And if you collected it improperly, it should go back or used for what the legislation requires you to use it for, and that's capital. Which brings me to the CT scanner is capital. But if you're not making your budget every year with respect to keeping the equipment in the existing hospital up to speed, because you can't request enough money, you have to have a pool of money you can draw from. And if you spend that pool of money, now what happens when you need something and you got to go to general revenue?
Thank you. If we were to invest in the CT scanner project and fully fund that project, is there an approval process that we have to go through to get the taxpayers' input, or is that something that we can just decide since the funds are already there?
So funds aren't in the actual, there's not enough funds in the actual reserve fund to most likely fund the CT scanner. And so specific to that, the process that we're aware of that's been communicated to us in Northern Health, if you were to purchase a CT scanner or provide funds, is that form that they've recently provided us, which we only found out about like in January, which was, but I don't think that's specific to the utilizing the reserve funds out of the hospital district budget. I think that's if the NRM wishes to take money from general surplus, for example, and say, hey, we're going to do a transfer of funds to Northern Health of X. And it's my understanding anyway, so correct me if I'm wrong, just like I said, this has been new to us when we're trying to, like to the mayor's point, trying to ensure that I mean, it's one thing to claim ignorance if you're doing something wrong. It's another thing to continue doing it wrong after you find out how you should be doing it right. So it's my understanding, like if no different than any other budget process, if council has a pool of funds that they can access and has the ability to fund a project, you go through the budget process essentially, right? Which again, it's not just a matter of saying this is what's in general surplus or other reserve funds to understand how it might impact future funds again. Right? I mean, we asked a question that asked about the reserve funds, for example, if we didn't contribute to a certain amount, what happens in the future? And it's the reality is you reduce your services or you have to play catch up at a later date. So if you were borrowing money up to a certain point, then you'd have to go to the public from a referendum perspective to borrow if it's past our borrowing limit. And other than that, I mean, if you have the funds of what you wish to tax, it's what the community is willing to bear from a taxation perspective, I guess, right? But it's my understanding that if you're to, I'll just use a round number, if it was $5 million for CT scanner, and we were able to, if we had the funds in other reserves or surplus that were accessible, I guess, and not utilized or weren't planned to be utilized in a future project or an impact something, the NRM would have the ability to, I guess, make a transfer. Is that of those funds in Northern Health to purchase a CT scan. What we want to show today, or anyone else could for that. Same if, I mean, if it's a portion from the NRN and a portion which is just the taxpayer, and a portion from if I think the Rotary's acknowledged they've got about approximately 150,000 is what they would be able to put towards a CT scanner at this point. I think is what they've communicated to us. What we want to show today is when we start talking reserve funds within the hospital district, there's not a great pool of funds and lots of questions that we still need answered based on future projects and how do you fund that if you know, because we can't answer what their plan is with a hospital, or if their plan is, you know, if they discussed it themselves based on the current FCI that they just are going to continue putting funds in this hospital to try to get that FCI, that number down, or is there discussions around potential replacement in the future? And I think the replacement also comes to, I'll say, need, like the Dawson Creek Hospital wasn't just an FCI number that determined if it was a replacement. It was also a, I'll use the word loosely, but an expansion of services potentially provided, like that existing facility wasn't able to accommodate. So there's some unanswered questions. I think the next step potentially would be to have Northern Health present that capital plan. They would actually outline what that capital plan looks like, and what the process is. And I've been in conversation with their capital group and with Angela about that. And I mean, they offered up today, but I wasn't sure, as I mentioned last week, about having a discussion at first, because usually when that presentation occurs, there might be lots of questions, but council doesn't necessarily have, or the board doesn't necessarily have the time at times to have fulsome dialogue themselves to kind of prep for that discussion too. So, which sometimes from a process perspective might create more questions than answers until we get an opportunity to circle back and have that conversation with them.
Well, I think that's where we're at. We need to get them to present to us what the longer term plan of a hospital replacement, and then what it looks like to keep the FCI at what the yearly capital looks like to keep the FCI where it is, or what an appropriate number is, and then look at our ability to raise money and how much reserve we've got. And if it's obvious that the reserve is not there, then we've got to dip into regular funds to increase that reserve.
Yeah.
Which means then you essentially you're funding the CT scanner not out of this, but out of general revenue.
Yeah, and as you said, Mayor, it's find out what those options are, and I'm sure there's been situations where regional districts have been short on funds in their hospital district budget, and what have those various options been, or various mechanisms or avenues been for them to fund projects if there's been a shortfall in the funds in that budget or in that reserve fund. And
Well, they borrow it.
well, either borrow it or or
it's only their last. Yeah, they're
yes, yeah, because the 40% deal is not written in stone.
There's construction standpoint. So I think I might be mistaken, but I think Fort St. John's Hospital was a P3 project.
That's right.
They had a different composition to that it wasn't the typical hospital district community funded project. There was a different blend there to make it more feasible, maybe.
Mhm. Okay, please.
So previous councils have had that capital presentation before, and I don't know that it will be addressing what the mayor has just asked for in terms of hospital replacement and all that. It just kind of, from what I remember, which could be short, goes through the process as to, how the whole capital process works. But I don't know that that's
not what
exactly
I'm looking
what
for.
you're looking for.
No.
So I would just caution that I don't know that I want to sit through the canned presentation again. For that matter, we could just get the slides and read them. It's pretty much what the presentation has been in the past. But I don't think that that's exactly what we're looking for.
No, I'm looking for what they're thinking about for the future. I mean, if this $30 million idea comes from them, then they have to know what that looks like and what gets us from here to there.
Yeah.
If not, if it's the 25 million of just keeping things going over time, using the same envelope, billing envelope, and just keeping things going, and over time it's going to cost you $25 million. Well, I want to know that too, because then I start to understand whether or not the 200,000 per year is enough to keep up with that, or whether we have to go into general revenue anyways. And if we have to go into general revenue anyways, all of a sudden you've got a line item in the budget year over year over year where you're collecting whatever we think we need, whatever that looks like. If they say no, you'll never get a new hospital report, Nelson, all we're ever prepared to do is keep you at 0.8, and it's always going to be, because it looks like from the, they're keeping right around that $100,000 a year mark, right? Because they
that's
know
the
that's all we're allowed to, or all we should be collecting.
Yeah. And that's like such a valid point. Like, we're thinking that we have to perhaps come up with 40%, or
Yeah.
that's negotiable about the amount for a new hospital. Well, they have to come up with 60%. And you look at what their capital has proposed, like they're not coming up. I don't think they're coming up with 60% of $30 million in the next 10 or 15 years, like unless things drastically change. They're looking at that third project that they've got in 2025, the hospital lab chemistry analyzer replacement. So they're quoting 2025, and the CT scanner is not there for 2025 either. So, I think the lack of information really tells me where they're headed.
So if we can tell them that we generally understand the process, we want to know what the actual plan for this hospital is, or for this regional hospital district, from a capital perspective. And, within reach, I guess, but talking about a hospital replacement, or no, forget it. You'll never get there. Not enough people in the community, whatever they say to us, there's got to be some kind of a long-term plan, strategic plan that I guess we're interested, because we really can't make budget decisions unless we know what that long-term plan is. We have to have a hospital in this community. We have to, in this region.
No, for
And,
sure.
and so therefore they must have some kind of so if you can talk to them and say, that's what we're interested in hearing. We generally understand how the money's raised. We don't understand the caps and things, but generally we're responsible for 40%. That's generally, we understand.
No, for sure. And that would be communicated for sure. It's my understanding that they would present, it's probably a bit of a canned piece, but there's also detail. They also want to provide detail, because they indicated that if you want to get into the detail of the project specific to each cost of the project, they would want to go in camera to have a discussion, just so they wouldn't show their hand in terms of what the value of some of those are for specific project detail costs. So that was, my understanding. It was part of the discussion I had with them a couple of weeks ago. But we'll ensure that, and again, another reason for having this discussion today was so that we can provide that direction and request to them specifically, and then circle a date in the calendar and get them back to the table or as part of a presentation, if that's the board's wishes.
Yeah, I think sooner rather than later. I mean, I'd like to have that conversation before they decide which CT scanner is appropriate for a community. I think we probably have a good idea which one it is, but until they tell us, I guess we don't know for sure. Because at that point, I think we're ready to start trying to figure out how to pull the funding together and make that work. So the sooner they can get back to us about what the long-term capital looks like, the better position we'll be in to decide about the CT scanner. Okay,
We'll do so for sure.
all right, that takes us to 7.2, which is the Regional Hospital District Procedure Bylaw. I think it's here as a draft. Is the idea that you'll present it to us at the next meeting as a bylaw, or are you looking for changes, or?
Yeah, I mean, we can, council can address it in any way they'd like. If there's no suggested changes at this stage, it could certainly go for readings and adoption. We'd strip the watermark off. If there's revisions you'd like to see, we can bring it back with those integrated for the next meeting for readings.
It looks to me like you used a lot of the information that we had for our own procedure bylaw to put in there. I mean, it looks good to me. I couldn't see anything that I wanted to change. So,
The only-
so
Oh, sorry. Yeah, yes. So it will read very similar to the existing procedure bylaw with the exception of the areas that we had flagged for revision of the council procedure bylaw. So order of proceedings in business is a bit different than what we have today. As well as the notice of motion section's been integrated. And then, of course, the timing of these meetings compared to normal our regular meetings is different, but those are the material differences.
yeah. And those are straightforward, really straightforward. Just identifying the difference between the two of us or the two groups. So help me with procedural process, then we can do all 4 readings, 3 readings and adoption ourselves today. Okay, so 3 readings and adoption have to be done separately though, right? 2 different motions, but at the same meeting. Okay, so I'll accept a motion for the first 3 readings of the Regional Hospital District Procedure Bylaw number 79, 2023.
So moved.
Moved by Councilor Roper. Is there a seconder for that? Seconded by Councilor Dickey. So it's on the floor for discussion. You're reluctant, seem to be reluctant. You're good with it? Okay. Good, then seeing no discussion on the first 3 readings of that, all in favor? Opposed? Okay. I'll accept the motion for adoption. Don't everybody speak at once. Moved by Councilor Dickey. Second by Councilor Roper. For adoption of the Regional Hospital District Procedure Bylaw number 79. No. All in favor? Opposed? That's carried. It was a Bonspiel weekend. I'll just put it that way. All right, correspondence. There is a letter from I'm not even going to try to pronounce the last name. Nick Prismatic. About the third quarter capital status reports. Is there any discussion on that? Anything anybody like to do with it? All right, so I'll move to discussion then. Moved by Councilor Goering, second by Councilor Dickey. All in favor? Opposed? Carried. Your question, please.
Okay, so I'm just wondering where it says, the NHR Emerge Care Safer Care Part 1. It's the regional project, and there's more than one regional project, right? So when it's a regional project and it says that this is going to be available at 26 Northern Health facilities, and the next one says at 18 Northern Health facilities, is there a way to know whether the Fort Nelson General Hospital would be one of those numbered facilities?
I can make the inquiry for sure.
Okay, could you? So it was the 2 of them, I think. The Emerge Care Safer Care Part 1, and then NHR In Care Safer Care Part 1. I don't know, no page. Oh, page number 32 and 33. And then I think the video conferencing one. So on page 34, that's a regional one too, and it doesn't say that it's going to be available. It doesn't give us the number. So then I'm just wondering, is that just taking place in Prince George or? Yeah. Okay. Thank you.
Yeah, because we need to understand, is there an expectation that we're partially funding these?
We are.
We are partially funding them. And so is that based on regional assessment? As opposed to, well, as a percentage of regional assessment to the entire Northern Health assessment, is that the way it's paid?
That's what we'll find out.
Okay.
Yeah.
Yeah, because understanding those numbers is also important if they're going to take it out of, the only place it can come from is that reserve. Yeah.
Most
Okay.
of the IT projects are considered regional in nature.
Yeah.
A lot of them have to do with patient records, which just lends to the transferability of that information when you receive care outside your home community.
Yeah.
But there's some, like a video conferencing equipment, for example, would be very site specific.
Yeah.
So some of them are kind of program investments, like the Safer Care is a program with a obviously with a technology piece. The In Care is a technology but program improvement. But then there's others, like you've noted, that we would see a change in our facility because of that particular project.
Yeah, and I mean, these projects are huge, right? I mean, the video conferencing one is 547,000. What was the one I was thinking? 9.9 million on the Safer Care initiative. If we were 1% of the entire, 1% of that is still a significant amount of money. Right? It's probably more than the 200,000 that we can gather each year.
And it's only available at 18. I don't know how
Yeah.
many facilities. That would be a really good question too, because one of the projects is available at 26 Northern Health facilities, and other projects available at 18 Northern Health facilities. So how many Northern Health facilities in the region are there? Like I don't know. I don't know that.
So it'll be interesting to find out what our share is to those. That could come back.
And if service is going to change here because of it.
So, Trevor, I'm confused about these reports, capital expenditures and the capital plan. So I'm on page 26 and 27 of the report. Can you follow these? Does anybody know how these work? Because the numbers, I mean, I'm usually pretty good with numbers and I can't follow how the numbers go throughout the chart.
That's with regards to the correspondence piece, the details.
Yeah, so these pages here, right, where they've outlined sort of the building integrity one is the one I'm looking at, but they're all essentially the same. I can't follow them because it looks to me like, if I look at the bottom line of this, it looks like we're paying $40,000 towards building integrity, and they're paying, and the Ministry of Health is paying $23,548 towards. Well, that's not 60-40. That's us paying more.
Right. So I'll say two things. I know exactly what you mean.
Yeah.
I have a reconciliation outside of this that I do when I receive it. The decision was made to provide this information simply as correspondence. So I don't include the analysis or the reconciliation work that I do behind the scenes.
Right.
But it might be worthwhile to include that. It took a fair bit of work to really track through what these numbers are. And Northern Help was very helpful in getting me up to speed with that. So I'll include the reconciliation work that I do. And I'll just make a couple of last comments. Some of the things that I think threw me off with this correspondence is they often repeat things that are complete and have been completed for some time. So you'll see the year that they're talking about, and then the category of expenses as well. So yeah, I understand where the confusion is, and we'll get you some more clear
Because then it speaks down
information.
it comes down to the 2023 budget that they're asking us to approve, and you can't follow the numbers along, right? To see exactly what it is that there's a total, and you've got that in your report, sort of what the total for the capital is, but it's hard to follow how much of each one we're funding and trying to, is it just a total and we get, 40,000, or where are they getting their split from? And, and when they move it over to operations, perhaps this is who. So just to flip over page 28, 2022 Fort Nelson General Hospital, the parking lot railing replacement was a $13,000, came from them apparently, and it was moved over to operations. But where's our share of that? And once you move something to operations, does that just mean that operations is going to look after the project? And where's the accountability with respect to whether that project actually gets done once you've put capital money into operating? Follow,
I
follow the
cer-
accountability line that I'm trying to make there?
Yes, I do.
Okay, and maybe, so maybe you can just, it's same with the maternity ramp repair. Like they've got 49,000, almost 50,000 into that. Our shares not, we can't see it there unless it's part of the 64 up top, but it doesn't show anything. And then it just says transfer to operations. And anytime that happens, it tells me that the operations can use it for whatever they want. Right. So if we can sort of get an understanding of how this whole spreadsheet works.
Yeah, I'll provide a response to that. That'll give clarity on all those issues.
Yeah.
Many of those questions I had to ask Northern Health, so I've got some
Yeah.
answers for you.
Yeah, the same thing is true with their 2023 budget. It looks like they want us to give them 65,000 and the Ministry of Health is only paying 8,122. Like it doesn't fit the 60-40 split thing. So, but it could be just an accounting thing in the way they present the information. Because I'm just completely thrown off by it. So if we can get some answers to that, that would help me understand their request, I guess, to us. All right. Any other questions on that? I have no addition. Is there any standing items? Seeing none. Any questions online? And I don't think we're going into closed. No. Adjournment is in order. I'll adjourn this meeting. Thank you very much, everybody.